first, did you know September is Prostate Cancer Awareness Month, a time to raise awareness about the second most common cause of cancer deaths in men? And joining us now is Dr. Brent Hardin, an outstanding urologist. How are you doing, Dr. Hardin?
I'm doing well, Tanya. Thank you for having me.
And thank you for joining us. So first off, just tell our viewers, you are an outstanding urologist. Where you work and what is it that you do?
Great question. So I'm a urologist. I'm board certified in urologic surgery, and I live in Oxford. I'm one partner in a four-man group that has locations in Oxford, Tupelo, Batesville, Grenada, and New Albany.
All right, let's talk about Prostate Cancer Awareness Month. How critical is it for men to get tested when it comes to prostate cancer?
Prostate cancer is one of those diseases that, when it's caught early, is very easily treatable. There's a lot of confusion, but it's really quite simple. There's a simple blood test called the PSA, and your regular doctor or nurse practitioner can order that blood value. And there's actually a guideline that once it gets up above a certain level, that you may need to see a urologist for a biopsy to diagnose prostate cancer.
Okay, when it comes to the risk factors, tell us a little bit about that, plus symptoms.
Yeah, so it's a disease that typically doesn't show up into mid or later life. And so the guideline recommendation on screening, getting that first PSA, is for most men from 50 to at least 70. And if there's a risk factor, which you mentioned, so first degree family relative, a brother, a father, an uncle, a grandfather, any sort of genetic implications. We know that prostate cancer in general is more common in African American men, and it's twice as lethal in African American men. So certainly anyone aged 50 to 60 to 70 in general health, good health, should get a PSA level if they want to know what their risks are.
And when it comes to symptoms, this is something that is very silent.
It is. Unfortunately, with stage 1 or 2 prostate cancer, you really don't know without having a biopsy. Most of the times it doesn't show up symptomatically until it's well aggressive and beyond the curable stage.
Now, when it comes to screenings, of course, we're showing some video here. How prevalent is that to get like an MRI?
Yeah, so start out with the PSA, and certainly if the number's over 4, and it's depending on your age, and then that will then prompt perhaps a biopsy, straightforward, or sometimes usually just a repeat PSA to make sure the first number is accurate. Some urologists will use an MRI imaging study to help further stratify your need for biopsy.
Okay.
And then we'll go forward with the biopsy based on that information.
All right, so it's important for men to go out and try to get that screening as much as possible.
Yep, simple blood test.
All right, thank you so much there, Dr. Hardin, for joining us.